friends. I just wanted to go ahead and get this video going for self-care when it comes to neck and head pain. There are several things that you can do in order to help with neck pain for sure. I know that it can be difficult to go through your day when you're having a lot of pain, especially when it's in the neck and head, and headaches can be a pretty serious issue for a lot of people. So this is just one thing that you can use to kind of maintain a better balance of pain management. So the first thing that I always like to do is first you kind of want to figure out, do we know why we're having this issue? You know, did you sleep wrong? Do you have old injuries that may be resurfacing? Do you have just chronic migraine problems? Have you been drinking enough water? Have you had anything to eat that you might have had sensitivity to? That can also be an issue if that might be something along with migraines where there's a food sensitivity. It could mean that you need to do somewhat of an elimination diet, and I can go into that in another video if anybody is interested. You can just message me about that. So first, I like to start with just, like I said, kind of evaluating what might be going on in your body. And if you can narrow it down, then that's definitely a head start on learning to maintain and having some pain management skills. Then we can go into doing some stretches and self-massage. The first thing I like to do when it comes to the massage part is you use your opposite hand. So say I use my right hand to the left side of my neck, and you find that little bony spot right under your ear, and you just add a little pressure, and you can use your other hand to give you a little more pressure, and you come down on the side of your neck, kind of tilting your head at the same time, and you're going to rub all the way down till you get to the end of your collarbone, this little bony area here at the tip of your shoulder. And so you, again, start at the bone under the ear and add some pressure, and you slowly glide down, stretching at the same time, and all the way to the tip of the shoulder where you hit the tip of the collarbone there. And you're going to do that at least 3 times. So you're going to come down, go all the way to the side. And that's going to hit some levator muscle and trapezius muscle, which is that big muscle that gets real tight in the shoulder. So that's going to help stretch those. Then you're going to continue to start. You're always going to start at that little bony notch under the ear. And you're going to go a little bit more anterior or in front of where you started. So this time you're going to kind of come into the center of the neck and more into the middle of the collarbone area here. So you're not coming all the way to the end, but you're coming a little bit more to the front. So again, under the ear, and you're adding more pressure with that top hand. And I like to always kind of stretch my head back or to the side where you feel like you're getting the best stretch, a little bit of both, just to that front of that collarbone there. And you're going to do that about 3 times. More if you feel like it needs more, of course. Then you're going to start again at that bony notch, and you're going to come around more to the front. Now you don't want to cover the trachea because then you might choke yourself, but you're going to come around more to the front, right onto that muscle that, you know, when you turn your neck, it kind of pops out. So you're just going to come around right on the side of the windpipe there. And you're going to feel the 2 kind of indent. You're going to end right at that first part of the collarbone where it starts. So you're just going to kind of tilt your head back. And sometimes if you feel like you're not getting enough of a stretch, what I like to do is just jet my chin forward. So up to the ceiling, more of a stretch. You're going to jet your chin out. and you're going to add that pressure. Then you're going to do the other side. So again, bony notch, opposite hand, other hand for more pressure. Come out to the side, all the way to the end, 3 or 4 times, however times you feel like you need it. Then you're going to come around to the center, a little bit back into the side with the head, 3 or 4 times, and then around to the front, right to that little bony notch there, and you're going to do that. Okay, so that's the start. When I have a headache and I know it's from tension, that always helps. Then you're going to work on the SCM muscle, or sternocleidomastoid. So that muscle that kind of pops out here, you kind of come down at an angle. Your ear is going to point toward, like if you had a shirt pocket. You're going to come down, and then that muscle is going to kind of get loosened up. So you just grab it a little bit, not too hard. If you feel a pulse, then you're pushing too hard. You don't want to push on the trachea. No, wait, not the trachea. You don't want to push on where you're getting the pulse, okay? You don't want to get to that artery. So you just kind of grab the muscle, and then you turn your head to just give it a little stretch. A little stretch. And you don't have to push so hard that you're really feeling a lot, because this muscle can release pretty good if you just do it a few times. And you're going to do both sides. Nice little stretch just on that SCM. Again, if you feel a pulse, release the grip a bit and just try to stretch that muscle. You're just going to stretch it a little bit. Okay? Then we're always in this forward motion. You know, we're driving, we're on the computer, we're always forward. Of course, that's how our bodies work. So we want to make sure we're paying attention to around the collarbone and the pectoral muscles. So you just want to add a little bit of pressure in between the ribs and the collarbone, just doing some circular motions. And doing those circular motions, you'll probably find some pretty decently tender areas. And when you do find those, just work a little bit more, add a little bit more circles, and just get under that collarbone a little bit and really just work out some of that pectoral muscle. And right under the collarbone, these muscles that we just worked on in the neck, they attach to the first, second, and third ribs. So you're going to get the end attachment to those muscles right here under the collarbone. And that's going to make a big difference in getting the remainder of those muscles relaxed a bit more. So you just work through that area, doing some circular motions around the ribs. Okay? And then, once that's done, I like to make sure that I get the back of the head. So here we're going to cup the hands right behind the head. Okay, and my thumbs are hooked right under my scalp. And once they're hooked, kind of under the scalp, you're going to gradually go up. And as you go up, your thumbs move up. And your thumbs stay here. And as you go down, your thumbs go down. Hopefully you're able to see that. So you go up and down. And you work your way from the inside to the outside. Okay? So up, thumbs go up, head goes down, thumbs go down. Then you move out a little bit, head goes up, thumbs go up, head goes down, thumbs go down. So you're just gliding up and down at the base of the skull, at the occipital muscles, and that's going to help get those loosened up. You're going to work your way all the way out, and generally you're going to find some pretty tender areas. Then we want to make sure that we're getting the scalp. The scalp is so important when it comes to tension in the head and the neck. So if you have your hair loose, you can literally just grab bits of your hair, kind of curl it in between your fingers, and make twisting motions. Okay, twisting motions, that's going to loosen up that connective tissue that's holding the muscles together throughout the head. So you just grab and twist all the way around the head. If you don't have hair, then you think of an S motion. So you just kind of push the skin together and out, push it together and out, push it together and out. And you can do that all over the head. You can even, if you have long hair, grab the entire hair and just pull. Just give it a nice, gentle pull so it helps to release the fascia in the scalp. The ears are also connected to that. So you can grab your base of your ears here, grab your ears around the cartilage. Then you're going to pull back and up and down. Back and up and down. And then rotate into circles. And you might hear a little bit of crunching. That's okay. As long as you're not feeling any intense pain. So that's fine. And then the jaw is also connected to, all this is connected. Everything is connected. The fascial connections, the muscles are connected into different joints. So when you have really tight neck muscles or headaches, a lot of times you're going to have tight jaw muscles. So you're going to feel right under your cheekbones next to your ears. There's kind of a little indent there. That's your temporomandibular joint. And you may have known it as the TMJ. And a lot of people might say, I have TMJ, but everybody has TMJ. It's when you have TMJ dysfunction that you'll have a lot of jaw pain. So if you kind of open your mouth and get into that joint and massage, right where it opens, then that's going to be, see, I think I had some comments in here. Oh, okay, Marie, for not choking yourself. Okay, it's cutting in and out. I'm sorry. Oh, Naomi's massaging you. That's so cute. When you don't want to come too close to the trachea. If you missed the very beginning, you want to make sure that you're definitely not coming across the windpipe when you're going across the neck. Nice broad stroke. So use your entire finger pads. So up and then just down to the collarbone. And then when you're doing your SCM, try not to use the tip of the finger, but more the side. So you're just kind of gently working your thumb into there and not jabbing a finger into the side of the neck. And again, there, don't want to feel a pulse. Just lighten up your stretch and your grip if you do. So I hope that helps. It may take a little bit of practice to kind of know, okay, I went too far, or, I can go a little further, just depending on how you feel. Okay, so I hope that answered your question. Now, back into the jaw. If you clench your jaw and you feel that muscle tighten, you want to be able to kind of go across that muscle as well, okay? That is your masseter muscle. That is your major chewing muscle. So you want to be able to go across that muscle, not too terribly hard because you do have glands in there, your salivary glands, and you want to just kind of massage that. You can get in there and up into the temples. That always feels good. Up around the forehead, make sure you're massaging all of that, even around the eyebrows and the eyes and the sinuses. Okay, all of that is really good to be able to massage. right under the base of the jaw. I have a visitor. Yes. Okay. We need to go.
Mom, what lesson do I have to read?
11.
Okay.
Okay. So right under the jaw, you have, you can get your thumb right under there. And then if you clench your thumb down again, you can kind of feel that muscle activate. That's an important muscle to get at too. You just want to be able to kind of go back and forth right under the jawline and just get that massaged out a little bit. Okay, so I don't want to take any more of your time. Hopefully that helped. You guys just continue to do that. If you need to do more things than that, some really good self-care tips is to get massage regularly. If you can't get massage regularly, I also encourage good chiropractic care, ice and heat to alternate, stretching. A couple stretches you can do is, like I said before, if you have your ear to go to your pocket, shirt pocket, you can you grab your head and just work your head down towards the shirt pocket, nice and gentle, and then again to the shirt pocket to the other side. Okay, so you want to be able to stretch those trapezius and levator muscles out on the side. Make sure you're keeping your pecs stretched out. So door jam stretches, make sure you're stretching everything out on that way because we're always in that forward motion. And I really love doTERRA past tense. So if I'm having some tension or headache and I don't have time to do a lot of stretching, I'll just use this, do a little roller on my temples and base of my skull, and that is a big relief for me. So that's always a great thing. Yoga, I love to do yoga in order to be able to keep things stretched and lengthened. And if you have any questions, please feel free to contact me. So thank you, my friends, and have a beautiful day. I'm good that helped. I'm glad that helped, Marie. Thanks for joining me today.